Did you know that 1 in every 4 families in the United States has a member suffering from a migraine? It is the third most common sickness worldwide. Hi everyone, and happy return to Bestie. A headache can be very bothersome and interfere with your daily activities. Although there are many different kinds of headaches, a migraine is among the worst. Migraines are thought to affect women more than males due to hormonal causes, and they usually run in families. Often, it's challenging to distinguish between headaches and migraines. Both can result in severe pain that either develops gradually or is brought on by clear triggers. We'll explain how to recognize if you have a headache or a migraine in today's video. Watch until the end to learn about everything from treatment choices to reasons and severity of pain to diagnosis and more. Causes and triggers. Causes and triggers. A typical headache might have a variety of triggers. Symptoms of anxiousness and sudden stress can begin. Depression may be present in certain patients. Musculoskeletal issues brought on by poor posture might result in headaches. Additional factors could include fatigue, thirst, hunger, odors, squinting, loud noises, and sunlight. A migraine can also be triggered by a variety of things. They are first believed to originate from chemical processes occurring within the brain. Hormonal fluctuations can cause a migraine in certain individuals. Certain women get migraines during their menstrual cycle. Menopause may also have an effect. For as many as 45% of women who experience migraines, it can exacerbate the condition. Migraines can also be brought on by hypoglycemia, or low blood sugar, by not eating. On the other hand, overindulging in sugary food could backfire. Additional causes may include dehydration, alcohol, computer screens, physical factors, exercise, medications, contraceptives, and mental anxiety. Which headache triggers do you experience most frequently? Tell us right away in the comments box below. Regularity. Frequently, usually, migraines are a recurrent issue. The frequency of your headaches by itself is not a reliable indicator of whether you have migraines. Both normal headaches and chronic migraines are considered chronic headaches if they last more than 15 days per month. Normal headaches don't usually affect your capacity to function. Migraines do. You can be suffering from a migraine if you're feeling queasy or throwing up, as well as sensitivity to light or sound. Frequent headaches that are not migraines can occur. Consult your physician if you suffer from persistent headache pain. Level of pain. Pain intensity. Severe, incapacitating pain is frequently caused by migraines. They typically have a throbbing or pulsing sensation. In addition, the pain may not be the hammering that is usually associated with migraines, but rather be continuous. Both sides of the head are typically affected by a typical headache. Your head may hurt on one side or both when you have a migraine. The discomfort may be felt behind your eyes or ears, in your neck, or in your temples. Conclusion. Diagnosis. The method for identifying migraines and headaches is nearly same. Your doctor may inquire about the following when you experience any type of headache. Do other members of your family suffer from migraines or other headache types? Are you allergic to anything? How much stress do you currently feel in your life? Do you find that headaches often begin with sneezing or coughing, or after a particularly strenuous workout? To rule out any other illnesses that might be the source of your symptoms, they will run testing. You might undergo imaging tests such as a CT or MRI, or blood testing. Aura-associated migraine symptoms can mimic those of a more serious illness, like a seizure or stroke. It's critical to get medical attention as soon as you become aware of an aura in order to determine what's wrong. You don't need to visit your doctor each time you get that identical aura once you've confirmed there are no other problems. But remember to come in if your symptoms worsen. Do I have your attention? Click that subscribe button to view additional videos. Become one of our millions of fans to see even more incredible Bestie content. Types of headaches. Different kinds of headaches. The nature and location of your discomfort can assist identify the sort of headache you are experiencing. Let's start by discussing tension headaches. Tension headaches are known to radiate to every side of the head, frequently starting at the back and moving forward. The most typical headache discomfort is this one. Tension headaches can be randomly caused by stress, eye strain, and hunger, and they can also be chronic. Cephalalgia is the second. These headaches usually occur when you are unwell or congested. They develop as pain behind the nose, cheeks, and eyes and are brought on by swelling in the sinus passages. When you first wake up in the morning and bend forward, the pain is usually at its worst. And lastly, there are cluster headaches, which typically hurt and happen in clusters. This indicates they occur regularly, every day, or even many times a day for months at a time. They are brought on by the release of serotonin and histamines, which causes the blood vessels in the brain to dilate. They may be brought on by intense lighting, strenuous activity, or even altitude. Migraine types. Migraine types. Although there are stages of migraines, there aren't really various kinds of them. The prodrome phase is the initial one. This stage, sometimes referred to as the pre-headache phase, is characterized by painless sensations that start days or hours before the migraine actually strikes. Food cravings, mood fluctuations, and stiff neck are a few of these. The aura phase is the second one. Sensory abnormalities that arise either before or during a migraine are referred to as auras. Auras can impact an individual's touch, vision, or speech. However, not all migraineurs experience auras. A growing blind patch, fuzzy vision, slurred or garbled speech, and numbness in the arm are a few manifestations of auras. The headache phase is the third. This is usually when the pain starts, and it can be anything from minor to incapacitating. The pain may get worse with movement, as well as with exposure to light, music, and scents. But other people never get headaches, even in the case of a migraine. The postdromal phase is the last stage. People may experience fatigue, confusion, or general illness at this phase. This requires medical attention, so get health insurance before you decide to pay the hospital a hefty sum of money. Natural remedies. Natural remedies. Techniques for relaxation, stress management, and massage are highly helpful in avoiding headaches. Stopping this pain also requires cutting back on screen time and getting proper sleep. Over-the-counter drugs like ibuprofen and acetaminophen can relieve headaches when necessary. Trigger point injections are another successful therapeutic option. You can discuss this type of therapy with your doctor. Furthermore, your physician may recommend treatments to halt a migraine as well as preventative ones. Identifying probable food triggers by keeping a food log is one of the greatest ways to prevent migraines altogether. Many people find that cutting out specific foods helps avoid migraine headaches. Additionally, some individuals find comfort using hypnosis, yoga, and meditation. In addition, treating any hormone imbalances may help delay the development of migraines, particularly for headaches that are often cyclical and hormonal in nature. One of the finest methods to look after your mental health is through yoga, which is also very beneficial for headaches and migraines. Watch 15 healthy benefits of doing yoga for 10 minutes every day to find out more about the advantages this wonderful activity has for your health. Returning again to unbeatable methods of distinguishing prescription medication used in the treatment of headache and migraine. Painkillers available over the counter, including ones containing prescription drugs for treatment. Aspirin, acetaminophen, and ibuprofen are most effective when taken before to the onset of severe migraine symptoms. These often work for regular headaches as well. Another option is to try some natural headache cures. Certain pharmaceutical drugs are categorized as abortive, since they stop the pain before it gets worse. They come in a variety of formats, such as self-injectable ones, pills that dissolve quickly, and nasal sprays. An abortive method might be effective if you experience migraines once a month or once every 6 months. However, you want to think about preventive migraine remedies if your headaches are becoming more common and you are approaching the chronic stage of the condition. CGRP is a brand new family of prescription medications. This is the first medicine class created especially to prevent migraines. As of right now, 4 CGRP medications are authorized to avoid migraines. 1 infusion is administered quarterly, and the other 3 are administered as monthly injections. Even now, many people use older migraine preventive medications that were intended to treat illnesses other than migraines, like depression, high blood pressure, or seizures. Devices that stimulate the head, neck, or arm with electricity or magnetism can reduce pain signals and aid in the treatment or prevention of migraines. How to identify the type of headache you're experiencing. Since there can be overlap in symptoms and many types of headaches, it's not always easy to discern. Maintain a headache journal. This is a really strong instrument. It enables you to prevent headaches before they happen. To begin, just mark each day that you get a headache with an X on the calendar. After you've got the hang of it, begin describing the features of your headache. How does it feel? What is the duration of it? Which drugs did you take? Were they helpful? Explore your triggers after delving into the traits. With the aid of this information, you and your physician may determine the kind of headaches you are having and the causes of them, enabling you to prevent headaches before they arise. Frequent, intense headaches could be an indication of a brain tumor or something more dangerous. Watch to find out how to recognize its signals. Watch one or both of these videos to get the most out of them. 10 warning signs you have a brain tumor or 7 early warning signs of a brain tumor you need to know about. Ever experienced a migraine attack? What was your course of action? Tell us in the space provided for comments below.